Welcome you all to our evidence synthesis section. I am Vanessa Jordan, for those who don't recognise me. I am an Associate Director of Cochrane New Zealand and a methodologist by training. I'm very happy to be chairing this session today, where we have a number of speakers who will be presenting for a 15-minute time slot. That is 10 minutes for the presentation and then 5 minutes for you all to have the opportunity to ask questions. During the presentations, please feel free to use the chat to pop a question in there, or at the end of each of the sessions, I'll ask you to indicate a raised hand with the icon at the bottom, and then I can ask you to ask your question in person if you would prefer. Our first speaker is going to be Zachary Munn, and he's telling us all about solving the crisis in evidence synthesis, which is fantastic. So I'm going to hand across to you, Zachary. For our speakers, if you'll see me in your top right-hand corner, I have a 3-minute card and I have a 1-minute card, which I'll just pop up so that you can keep a track of your timekeeping. But now to hand it over to you, Zachary.
Fantastic. Thank you, Vanessa, and thank you everyone for coming along to this session. It's great to see so many colleagues and friends on this Zoom call. So hopefully this will be a good chance to get some feedback from you all on what I am discussing. So the title as submitted to the conference was Solving the Crisis in Evidence Synthesis, but I started thinking this is probably a bit too grandiose, and it's actually what we're trying to do with this project is actually to address some of the confusion in evidence synthesis. So with a fear of overselling and under-delivering, I've modified the title somewhat for this talk. So hopefully what we're doing with this project is to help solve and reduce some of the confusion in evidence synthesis through the use of developing a structured taxonomy for evidence synthesis. By way of introduction and some of my disclosures as well, these are some of my roles. So I'm a director at JBI, the director of the JBI Adelaide Grade Centre, and I'm also the current chair of the Guidelines International Network. And this project has been funded by the NHMRC Investigator Grant Funding Scheme, but I have no direct or indirect financial conflicts of interest. I'd also like to acknowledge that I'm here in Adelaide on a beautiful sunny Adelaide morning, and where I am, it's the traditional lands of the Kaurna people, and I'd like to pay respect to elders past, present and emerging, and acknowledge that this land always was and always will be Kaurna land. So what I'm hoping to discuss over the next 9 or so minutes is evidence synthesis, different types of evidence synthesis, our plan to develop this evidence synthesis taxonomy, and where we are at currently with our efforts. Now, looking at who's here today on the call, it looks, I know many of you who are here, and I'm sure you don't need too much of an introduction to evidence synthesis. But I thought I'd just share this definition with you all on evidence synthesis, which is from Evidence Synthesis International. And myself and colleagues, we actually hunted around to try to find what we thought was the best definition for evidence synthesis, and this is what we thought might be the best one at the moment. And really it goes into the importance of evidence synthesis and the fact that evidence syntheses are the evidence base in evidence-based policy or evidence-based medicine, etc. And it goes on to the importance of explicit, transparent and rigorous methods for conducting evidence synthesis. But what I think is important is this is not a definition for systematic reviews, but rather evidence synthesis more generally. And what I want to talk about more today is all the different types of evidence syntheses. Now, we also do know that the evidence synthesis movement and systematic reviews in general as well are facing a little bit of a crisis or a number of challenges. And one of the challenges is that there are just so many systematic reviews and evidence synthesis projects being conducted at the moment. A recent investigation found that there's approximately about 80 reviews being published every single day. And we know across all of those reviews, there are a lot of reviews that are duplicate reviews and potentially redundant reviews because others have already answered the question using trustworthy methods. Unfortunately, we also know that a lot of these reviews are of poor quality or are very poorly reported, which hinders their use in practice or to inform guidelines or policy. And they're not adhering necessarily to reporting standards like PRISMA or following good methods. And unfortunately, a lot of these reviews aren't always translated, say, into clinical practice guidelines and recommendations within guidelines, or actually being translated into practice as well, and may not be contributing to a knowledge translation pathway. And from our own experience, we're finding increasingly that a lot of these reviews that are being done are probably using incorrect approaches or even methods for the question that they're trying to answer. And this is something we've particularly seen with the explosion and popularity of scoping reviews, where people are starting to try to use scoping reviews to answer every single evidence synthesis question under the sun, when in actual fact, they should probably be using a different approach. So what am I talking about here when I'm mentioning evidence synthesis? Well, there are a lot of different reviews now that can be done under this broad banner of evidence synthesis, and there's a few examples here on the slide, and quite a few different authors have looked into some of the different approaches and started to try to classify and categorize all of the different approaches to evidence synthesis. And if we look at systematic reviews themselves, we can also see that there are now a lot more or a lot of different types of systematic reviews that can be done, which answer a number of different questions. Some which have more guidance or standards in place than others as well. And this is an evolving field also. And the same goes with scoping reviews. Perhaps there's many different types of scoping reviews as well. Now, what this has led to is really a fair bit of confusion amongst authors and potential systematic reviewers or people conducting evidence synthesis projects about what approach to choose. And myself and colleagues, we run a lot of training programs. We also act as editors or associate editors for journals. And we're seeing that there is a lot of confusion and a lack of clarity about what evidence synthesis approach they should be using and what's best suited to them for their particular question that they're trying to answer. I can say that there is a really nifty tool which can help to answer this question, which some of you may have heard of, which is called the What Review is Right for You tool, where you answer a set of questions and then you actually the program itself will suggest an approach for you. But even this tool obviously needs to be informed by some sort of comprehensive understanding of all the different approaches in evidence synthesis. And this leads me to what we're trying to do with this project. As we see more and more evidence synthesis projects being done, we see its importance being highlighted further across the globe. And this growing enthusiasm for evidence synthesis, we need to make sure that people who are conducting these projects are actually making the best choices in terms of the design and conduct of these evidence synthesis projects. We want to make sure that people are conducting these as efficiently and accurately as possible, and we want to make sure that these syntheses are trustworthy as well. And one way to perhaps achieve some of these aims is to develop a resource that guides and drives appropriate synthesis approaches that respond to relevant clinical and policy needs and questions. And we think this could be a research-informed evidence synthesis taxonomy. Now, we're not the first to advocate for an evidence synthesis taxonomy or some sort of categorization or classification scheme in evidence synthesis. And quite a few authors have done some work in this previously. Every few years or so, a new classification scheme actually comes out. One of the early schemes, and that was quite popular, was that by Grant and Booth, where they provided their typology of 14 review types. But once again, this is a little bit out of date now. And in fact, in some previous work, it was actually said that it's probably going to be too hard to develop an overall taxonomy of all types of reviews and evidence synthesis, because the rate of development of new approaches is perhaps too fast and there is a lot of overlap. So maybe we're aiming too high with this project, but I think what we're trying to, if we really want to address some of these issues in evidence synthesis, and if we look at this position statement from Evidence Synthesis International, we need to find some way to agree as an international community of people conducting and experts in evidence synthesis to try to ideally come up with a shared understanding of different approaches in evidence synthesis, ideally shared language and shared methods as well, and also acknowledge that evidence synthesis will continue to evolve and continue to grow. So creating static taxonomies or classification systems probably isn't the way forward. In fact, we might need a continuously updated and evolving, living, if you will, evidence synthesis taxonomy. And just to highlight that this is an increasing or an evolving field, even just this week, there was this publication from the WHO looking at systematic reviews in chemical risk assessment. So where does this lead us? Well, we want to create this taxonomy. We want it to be a comprehensive resource for anyone interested in evidence synthesis and to direct people to conducting the right review for them, for their question, and to use rigorous and transparent methods. And this is just a very simple example or schematic of how this might look. Obviously, we're talking about evidence synthesis. This is a kingdom we're talking about. And then there's lots of different types of evidence synthesis approaches. And underneath each of these are types. And just a caveat here, this is by no means comprehensive. This is just for illustrative purposes only. Under each of these different types, there are also a number of, let's say, divisions or subtypes for these evidence synthesis approaches. And if we take prognostic systematic reviews as an example, within prognostic systematic reviews, you could be looking at overall prognosis, prognostic factors, prognostic models, or treatment effect modifiers, or stratified medicine. And then if we pick just one of these subtypes, like overall prognosis, then we want to make sure that we're directing people to the methodological guidance, if there's any software that they can use, if there's an extension to the Prisma statement that they might be relevant for this type, or if there's a grade approach as well for this type of review, and so on. And hopefully what we want to do is create this sort of map for all of the different types, not replicate the actual guidance, but actually provide people the way to get to the relevant guidance or approaches for each of these different reviews. So where are we up to? We're currently forming an advisory panel, and it's been great to see so many people join this panel and be willing to give us some of their time. We're undertaking a scoping review of evidence synthesis approaches, which we may transition to a living scoping review so we can always keep up to date. We're also making sure that we are doing this in a collaborative spirit and reaching out to others who are doing similar work so that we can make sure we do have a shared and common understanding, and we're building infrastructure to support this project. And if you're interested, please do get involved. The people here are the perfect people we want to be talking to. So if you are interested, please do send me an email. So that's, I can see I'm basically out of time, but so that's what we're trying to do. We're trying to build this evidence synthesis taxonomy, which will be a living repository and compendium identifying different approaches, methods, and guidance. And we want to make sure that people are doing the right reviews for the right reasons, using the right methods. And that is the end of my talk, and I'm happy to take any questions from anyone.
Thank you so much, Zachary. That was really interesting. And as an editor and reviewer myself for journals, I applaud your effort, having read so many not quite right reviews that have come my way. So thank you for this work. Does anybody have a question? Please feel free to raise your hand or pop it in the chat. I will begin. Zachary, what's going to be involved in turning this into a living document?
Yeah, so obviously we'll hopefully have a lot of publications based on this work. That's always good. But really, if we want this to be a living, continuously updated type resource, we're looking at doing it on a wiki type platform so that we actually can make continuous updates to it as new approaches emerge, or even not necessarily a whole new approach, but say as a Prisma, an extension to a Prisma statement is published, or new grade guidance, or an update to the Cochrane Handbook or JBI Handbook or whatever it may be, we'll need to make sure we're continuously updating that. So some sort of wiki type platform is what we're looking at.
Okay. All right, if there are, we've got something in the chat.
Oh, thanks, Matt, for sharing that.
Vanessa, I just had one question, if I could ask that.
Go for it, Steve.
Zach, just one comment you made, I think, earlier on about scoping reviews, and that you thought that people were possibly doing scoping reviews for the wrong reasons. Could you just elaborate on that?
Yes, for sure. So this is something we're actually being inundated with at JBI as we publish scoping reviews in our journal, and we're seeing a lot of people doing scoping reviews trying to answer questions regarding the effectiveness of interventions, for example. And there's even scoping reviews with meta-analyses and these kind of things, or they're doing scoping reviews trying to look at the experiences of patients living with a condition. And for all of these types of questions or aims, you're better off doing the relevant systematic review approach. Not saying that scoping reviews aren't useful and don't have their purpose, of course they do, but I think they're being somewhat misused at the moment.
Thank you.
Thank you. Hanan, did you have a question?
Yes, please. Thank you. Just one thing, Steve, we're running a workshop about scoping reviews this afternoon. So we'll be talking about differences between systematic reviews and scoping reviews. So that's one thing. Now, the other thing, thanks so much, Zach, for your exciting presentation. And I know I'm involved with you in doing this project. I just want to ask you whether you'll be focusing on the JBI methodologies or you'll be open to other methodologies as well.
No, it's, I think, to be useful, it needs to be an international effort, bringing in all the groups interested in evidence synthesis. Obviously, when we look at linking out to guidance for particular review types, we'll be able to list, JBI, Cochrane, Campbell, whoever it may be, producing that guidance. But no, I think it definitely needs to be broader than just JBI.
Thanks so much.
And that just segues nicely into asking Hanan to keep her mic on as she is our next presenter. Zachary, would you mind stop sharing? And that will allow our next speaker. So next we have Hanan Khalil, I hope I've pronounced that correctly, yes, who's going to talk about challenges to evidence synthesis during COVID, which occupies most of our minds at the moment. Now I pass over to you.
Thanks very much, Vanessa, and thanks everyone for coming to my talk. So I present today some work that I did over the last 4 months with a group of my colleagues, and just to share what we've done during this time. So just a brief outline. So I'll go through what's known about the topic, key findings from our study, and what's adding to what's already known, and just a few ideas about the implication of this and where we go next. So this is just, I don't want to repeat a lot of the stuff that Zach has mentioned and some of the plenary speakers have also mentioned, but very briefly, we all can appreciate the high speed and the scale in which research on the COVID-19 pandemic is published. Are challenging for decision makers, clinicians, patients, and the public. And this is mainly because of the difficulty in synthesizing all this data in a timely manner. This has also been partly addressed by the use of living and rapid reviews to overcome the vast number of published papers so far. We've also seen a lot of platforms and initiatives that have started during the pandemic, and some of these include the COVID End, Lead COVID, the COVID NMA project, the WHO, the Power Living Reviews, and the Epistemonicus. And some of you may be aware of some of these platforms, but pretty much they're all about building evidence for the COVID-19 pandemic in different ways. Some of them do produce evidence summaries about the best available evidence to a particular problem, and others really were targeted to address public health interventions and national policies. So you could see a lot of organizations have started already working on these challenges, and with some success. I'll pick up on some of these later on in my talk. But for the time being, with actually looking at what has been published and the initiatives, we found similar to what Zach has mentioned in his previous talk. So despite the advances made in the last 18 months, these initiatives and other experiences detailed by knowledge users have uncovered many shortcomings of the current research synthesis, including obviously the low quality of primary studies, the complexity of identifying even relevant studies, the lack of robustness in the critical appraisal techniques, variation in data analysis in some of the methodologies, and really the time taken to produce systematic reviews. So what we decided to do, we decided to undertake a scoping review to look at these challenges in a systematic way, to identify what these challenges are and how we can propose some recommendations to address these challenges. So we used the scoping review methodologies. That was a methodology that was, again, initiated by our group, including Zach and a couple of others here. So we've included the 28 studies in our review, and we didn't restrict our review to peer-reviewed, but we've opened it to both peer-reviewed and non-peer-reviewed papers. So we've included editorials, letters to the editors, and as you can imagine, in the last 18 months, there was many publications citing some of these challenges, but most of them were done in a sort of in an ad hoc way. So, and that's why we thought a scoping review would be good to summarize some of the challenges that are there. What we found, we tried to categorize some of our challenges, so into upstream challenges, ES level challenges, downstream challenges, and contextual challenges. So we found that there was lots of these challenges to do with the production of the evidence. There were also some to do with the quality of the evidence produced, the dissemination of the evidence, and the social and political context. I know we don't have much time on this, but this, it's only 10 minutes that I'm presenting here, but this slide pretty much summarizes our findings, and we tried again to subcategorize them into different themes. So challenges to do with the primary studies. So we found the high output of primary studies that was really hard to keep up with what's been published. Most of these studies were also in suboptimal quality, like what Zach mentioned. Going through some of these, we found that they probably shouldn't have been published. So as an editor of the International Journal for a number of years and a co-editor of JBI Evidence Implementation, some of the journal articles that were published were really below standards. We also uncovered the lack of really inclusion of non-English studies. So we know that Chinese researchers have also published a massive number of research in this area, but unfortunately, because of the language restrictions, and none of these literature were included in the scoping reviews published or systematic reviews published in English. And there was also compromise to the peer review process by the high speed of publications of preprints. There was also database management issues, so things like fragmentation of the COVID trials landscape. So many, a lot of grants and funding have been thrown to research, managements and treatments for COVID. And many platforms have been initiated to this, and many of them were doing similar work. We've also noticed there was a research, there was problems with some of the keywords, some of the indexing of the pandemic, COVID-19 words, some of the mesh words also. So, and that led to omission of some of the studies when you actually search them through the PubMed and Medline because of the inaccuracy in their indexing. We also found that there was also problems with team capacity, so lack of collaboration between groups undertaking similar projects, duplication of some of the efforts, which led to research waste, which again, it's a theme that has been also mentioned by some of the speakers this morning. Some of the problems with the process included outdated reviews and the fact that we had to opt for other methodologies like living rapid reviews. There was also problems with funding. A lot of this work needed a huge amount of money to be able to be done appropriately. And we also found some contextual factors like the misleading public announcement by leaders about the different effectiveness of some of the treatments that were found, like the chloroquine, the corticosteroids, and so on. And another theme that was probably forgotten a little bit is the needs of the LMIC communities, and things like, simple things that we take for granted, like, the network, internet working properly, access to database, being accessing English language literature and so on. That's definitely not being easily accessed by the LMIC communities. So we found that this was the first scoping review to present some of these challenges in a systematic way. We've also found that the challenges described, they faced by not only the stakeholders of the evidence, but also general editors, peer reviewers, and systematic reviewers. And we've also found that there were major advances that was done, that I've mentioned before, by many platforms have used different strategies to overcome some of this. So I just want to mention a couple of these very briefly. So we've seen crowdsourcing being used by Cochrane to eliminate some of these problems. We've seen also some of the collaboration partnership that has been also used by some of these platforms, and new methodologies being published as well. So what's the implication of this work and what could change now? So we've recommended to improve this by having a framework of artificial intelligence, international collaboration, and enough funding to be able to move forward with good methodologies, reliable methodologies that reduce some of the challenges that we have identified from this work. And we've already begun to work on this, on a model called Evidence Synthesis 2.0, which has been published earlier this year, leveraging on some of these methods, which is crowdsourcing, web-based platform, collaborators. And I'm currently working with my colleagues to operationalize some of these ideas to be able to produce Evidence Synthesis 2.0. So watch out for some papers that will be coming out, and we'll be actually calling on some of this, on this community as well, to collaborate with us to be able to talk or to operationalize some of these ideas together. And just finally, I'd like to acknowledge my co-authors, and just to let you know that this work has just been published in the Journal of Clinical Epidemiology just last week, and it's been tweeted several times. So I'd encourage you, if you would like to know a little bit more about this presentation, to read it. It's available online at the moment, and to tweet it too. And I'm happy to answer any questions. And I'm sorry about the quick pace, but it's only 10 minutes that I had.
Thank you very much for a fascinating presentation. That was fantastic. Just keeping an eye on a chat. So we do have a question from Aidan Tan, and he's asking you if you can to expand on what a framework of artificial intelligence would look like.
Thank you very much. So we're actually, I'm presenting on automation tools tomorrow. So if you're interested in artificial intelligence and automation tools, please come tomorrow to a presentation like this one. But just to talk briefly about artificial intelligence. So I think artificial intelligence has been used a lot in data extraction as well as data selection. So we'll be using a lot of tools in this aspirational model of evidence synthesis to select relevant data, relevant studies to answer different questions, and to also extract relevant data to have it available for clinicians and end users to use. So this is really the pretty much very simple answer about the artificial intelligence. So we'll be using natural language processing. Some of the tools that are already available are used by epistemologists, which we are currently trying to look at. And Gabriel Rada is a founder of epistemologists, and he's obviously one of my co-authors, and we'll be operationalizing and expanding a little bit about that framework. But it's mainly based on automation tools, which I'll be discussing tomorrow. Thank you.
Thank you. Just a quick question from me. In your challenges that you discovered, did anybody refer to the trustworthiness of the evidence? We all know that that has become a thing, especially with the ivermectin studies.
Absolutely. And this is actually a question that I wanted to ask Julian as well in the plenary this morning. I think clinicians do understand the fact that evidence does change, particularly with larger studies and moving quickly from different, from one treatment to another, one intervention to another. So I think there is an acceptance of that the evidence can change. The trustworthiness, I think that also comes with having robust methodologies and also who's doing reviews. And that goes back to the importance of the work that Zach is doing as well, trying to minimize the differences and in evidence synthesis terms and taxonomies and all of that. It is a problem at the moment, but we're just trying to address it. So thanks, Vanessa, for that.
If there's no further questions, I can't see any hands raised, we might move on to our next speaker. So thank you very much, Hanan.
Thank you.
And so now I ask Sue Brennan to unmute and share her screen. And she's going to talk to us about using grade in overviews and in guidelines. Over to you, Sue.
Thanks, Vanessa, and thanks everyone for joining me. Just confirming you can see my slides, Vanessa. Thank you. Okay, so I'm going to talk about some work we've been doing with the grade working group, and it's about identifying and addressing the challenges in applying grade to evidence from existing systematic reviews, particularly in the context of overviews of reviews and clinical practice guidelines. And this is very much a large collaborative effort, so I'm presenting on behalf of the grade project group on overviews, which includes some members who are here with us today, and my project co-lead, Jo McKenzie. Just to begin with a declaration, I'm employed by Cochrane Australia, and the most important aspects that are pertinent to this particular presentation is that I'm responsible for leading our Melbourne Grade Centre, and I'm an elected member of the executive for the International Grade Working Group. So to start with an outline of the presentation, I will talk a bit about the backgrounds and aims of this work. I'll talk about the methods in two parts. So first of all, covering off some of the background research we did to inform the work of the grade working group, and a concept paper that's arising out of that work. I'll talk about the results of our background work, first of all, particularly thinking about the different pathways taken in overviews and how these impact on the data we have available for a grade assessment. And then I'll give a bit of an overview of the concept paper that we've been working on. So thinking about Cochrane's work in overviews, really this began by trying to provide an accessible front end for decision makers to access findings of multiple related reviews. And this is exemplified by this review of assisted reproductive technology, in which the overview authors brought together the findings from 68 Cochrane reviews on fertility treatments. Our interest in overviews really began with work that we were doing for the NH and MRC, and in particular some work that was done to inform the review of the Australian Government rebate on private health insurance on natural therapies back in 2015. This review is informed by overviews of evidence on the effects of natural therapies, and in the process of doing so, findings were aggregated from 348 different systematic reviews, 675 component trials across 68 conditions. And using existing systematic reviews in this kind of context is really driven by a desire to expedite the review of large and complex bodies of evidence. Since I started in the world of Cochrane, things have changed quite dramatically. So back when I began, we were looking at maybe between 3,000 and 5,000 reviews being produced a year by the research community.
So you seem to have frozen. Are you still with us? I think we have temporarily lost our speaker. We will just give her a minute, see if she can get a connection back.
Yeah, sometimes the connection down in Maui is not brilliant.
Okay. It looks like Sue has left us. Maybe she's going to try and rejoin in. Shall we move on? Maybe, and then come back. Just seeing if I can see her in the list of attendees. Okay, so I think what we'll do is move on to our next speaker. If
I've just got Sue on the phone, actually. Hang on, Vanessa.
Okay. Come on.
Hi, Sue.
Oh, she's back.
Sorry about that, everyone. Our internet connection just dropped out completely. There must be some kind of gremlin in the works today, because it feels like
And we've lost Sue on the phone as well. Are you there, Sue?
have you still got me, Vanessa?
Oh, there we go. Now we can hear you.
I'm going to turn my video off, but it actually isn't a bandwidth thing. It is something to do with the connection. So, but I will stop the video just in case.
Okay, yeah, sounds good.
Okay, all right. So I was at the point of telling you about where grade fitted into this process. So basically grade provides a systematic and transparent method to interpret the findings of a systematic review. And largely that has been focusing on how we can do that by considering the body of evidence from primary studies. So much less of the guidance is considered what we do when we actually are looking at evidence from a review. When we apply grade, we consider the certainty of the evidence for an individual outcome, and generally come up with a rating between high and very low certainty of the evidence. That rating brings together a lot of information from our systematic review. In particular, we consider whether or not the studies have important methodological limitations, whether the findings are consistent across studies, whether there are concerns that the studies don't directly address our question, whether we are confident in the size and direction of the effect, so the precision of the effect, and whether we might be missing studies, whether it's whole studies or specific outcomes. Ideally, in an overview, the authors will be able to do something like this, where they can just basically extract and report the grade assessment directly from the included systematic reviews. However, this assumes that the included reviews report results for PICO questions that match each of our overview PICO, that the reviews report a grade assessment or the data to grade results for each outcome, that those reviews are methodologically sound such that we can trust the results and the data to grade, and that they're up to date and we're not missing any studies. Unfortunately, increasingly it's the case that these criteria are not met. So the GRADE project group has been working on some work to try to help authors of overviews address this. Specifically, the end goal of this is to provide guidance or principles for how to apply grading overviews when there are limitations in the data from systematic reviews. And that guidance might ultimately provide guidance that says you can proceed as usual with your grade assessment in certain circumstances. There may be circumstances where there are limitations that lead you to downgrade, And there may be circumstances where the limitations are so great that we feel that we can't apply grade. But there are many challenges we need to kind of get across before we can provide specific on how to do that. And so the bulk of our work today has been focused on some conceptual work, particularly in this conceptual paper, in which we have two main aims. The first of which is to identify possible limitations in the data available for grading certainty. And the second is to identify the implications of these limitations for grading certainty. Both of those aims will feed into guidance and provide the basis for guidance downstream. So just thinking a little bit about the methods for our work, and there's the two components, the background research and a concept paper. The background research has involved a review of methods guidance for overviews, really thinking about all aspects of the overviews, not just the assessment of certainty. It's involved a survey of current practice, looking at how certainty is assessed in 50 overviews, and interviews with grade and overview methodologists about their approach to applying grade. And that probably has been the most fruitful of all those endeavours. For the concept paper development, we've followed a standard grade process, which involves bringing together members of the working group. We've had iterative discussion among the project group members to identify and categorise limitations in the data available to grade from systematic reviews. We've considered the implications of these limitations for applying grade, and we're collating illustrative examples. So I want to just briefly go through the results of the background work, thinking about the pathways taken in an overview and the impact on data to grade. So from our background research, we know that authors take many different approaches in overviews of systematic reviews. Let's assume, for example, that for a given PICO, there are multiple meta-analyses available, each from a separate systematic review. The overview authors will grade a single result. There are many pathways to get to this single meta-analytic result. Let's take an example. So for example, they may apply methodological eligibility criteria to include one systematic review and one meta-analytic result, leading to them to a single meta-analytic result to grade. Alternatively, they might apply methodological criteria to include all eligible systematic reviews. They might use a cutoff, for example, to determine which of the reviews are eligible for each PICO. They might then apply decision rules to select one meta-analysis, perhaps selecting the meta-analysis with the most complete information, again ending with a single meta-analytic result to grade. Third option is that they might include all systematic reviews. They might undertake a new meta-analysis using data from existing reviews, again leading to a single meta-analytic result to grade. And there are many other pathways that are possible, and those of you who have done an overview will start to recognise some of these. There are also different pathways possible for all other steps in an overview. For example, if you're trying to gather data to assess the risk of bias of primary studies, you might extract available information, check a sample of the assessments and reassess any that are of concern. You might extract the risk of bias assessment just for that meta-analytic result that you had extracted. You might extract risk of bias assessments from all systematic reviews, compare the assessments for consistency and possible errors, all of which will lead you to a set of data to apply grade methods to when you're assessing the risk of bias of primary studies. And there are other pathways. What we know is that the pathways taken in an overview of systematic reviews influence the results and information available to assess grade domains, what we call the data to grade. The extent to which the data to grade is complete and trustworthy. And overview authors can proceed as usual if the data to grade are optimal. So if you end up with data from a systematic review that really approximates what you would want if you've done the review yourself, or if in the process of doing your overview you address any limitations that you identify, then you can probably apply grade as usual. However, if the data to grade has limitations that are not addressed, the limitations and their implications need to be understood. So that brings me to the last bit of the slide, and Vanessa's given me the 1 minute mark. She's probably thinking I'm not going to get there, but I'll get close. So just to think about what we've done in the concept paper, we're really thinking about the limitations of the data to grade and their implications. So we've assumed the following, that in any particular overview, we have a range of data sources, and these come primarily from systematic reviews, knowing this is an overview of reviews. You might have one systematic review for a given PICO. You might have multiple systematic reviews addressing the same PICO, but we've selected one of them. Or we might have multiple systematic reviews addressing a PICO and we've selected more than one. Optionally, we might have primary studies, either to update the search or to verify results from the primary studies in the reviews. We then apply that of possible overview methods, and we're not going to make any presumptions about the methods people use, but that will lead each overview author to have results to grade. They might be a single meta-analytic result. It might be a whole range of other options down to having no meta-analysis. And they will also have that data to grade that I've already alluded to for each of the grade domains. So what we've done in our concept paper is for each grade domain, we've characterised the limitations of the data available to grade with illustrative examples, and we've identified the implications for applying grade, including circumstances in which those limitations might be mitigated. The work we've done is being presented at the moment in a series of tables like this, and I'll just give you a couple of very quick examples. So taking the data to grade for risk of bias, we might have limitations arising from the methodological quality of existing reviews. That is such that it undermines our trust in the data to grade. So we might have informal risk of bias assessments, concerns about the assessment process, or the risk of bias judgments. We might have limitations arising from incomplete reporting or missing information. For example, only having a summary score for risk of bias assessments, having no risk of bias assessment, or incomplete information to judge the impact of risk of bias. Two of the other things that overview authors very frequently encounter are where they have limitations arising from important differences in the PICO of the selected reviews and an overview PICO. We've covered this one off under indirectness. And the other is where they have concerns about missing studies due to the currency or comprehensiveness of the search. And we've covered this off under publication bias. So in conclusion, the grade concept paper the working group has been developing is intended to capture possible limitations in the data to grade, particularly thinking about limitations arising from the process and the implications of these for applying grade methods. And our goal really is to identify limitations such that we can develop grade guidance to allow authors to apply grade in common scenarios encountered when using existing evidence from reviews. I'm done.
Thank you very much, Sue, and thank you for coping with the technical difficulties as well. Never makes a talk easy. Very quickly, if anybody has any questions, please raise your hand or add to the chat, and I'll just ask a very quick one myself. Did you consider networks that are involved in overviews at all, or did you steer away from those? Sorry, Sue, you're muted.
By networks, you mean network meta-analyses?
Yeah.
No, we've left that to one side because the grade methods for assessing certainty of NMAs is quite different and much more complex. So I think the two things need to be disentangled in the first instance.
Okay, thank you. Do we have any other questions, raised hands? If not, we will move on because we're starting to lag a little bit behind. Thank you very much, Sue, for that talk. That was fantastic. And I'm going to move on to Cindy Stern, if Cindy can share her screen. And Cindy's going to talk to us about mixed method systematic reviews.
Thanks, Vanessa. Can I just confirm that you can see everything all right?
Yes, I can. Great.
Okay. Well, hello, everyone, and welcome to this presentation. My name is Cindy Stern, and I will be presenting today with my colleague, Dr. Lucy Lynn Lizarondo. So a few quick disclosures. We are co-conveners of the JBI Mixed Methods Methodology Group, and we are presenting on behalf of all the members of the group who are listed on this slide. We are both employees of JBI at the University of Adelaide, and we are co-authors of the JBI Mixed Methods chapter in the JBI Manual for Evidence Synthesis. And I'd just like to acknowledge that we are meeting today on the traditional country of the Kaurna people of the Adelaide Plains, and we pay respect to elders past and present. So the focus on this presentation is on a project that the group has recently completed. We will first very briefly set the scene and introduce mixed methods and the JBI approach, and then discuss the rationale for the project, the methods we used and our results, and what we concluded, including some recommendations for practice, or for reviewers, sorry. So when many people think of mixed methods, they tend to think of mixed methods in the context of primary studies. So primary studies which encompass diverse types of research. This presentation is focused at the systematic review level, which may include primary mixed method studies, but also other types of primary study designs. And we refer to this as a mixed method systematic review. So while mixed methods research can encompass diverse types of evidence, such as quantitative, qualitative, or textual evidence, for example, our current guidance focuses exclusively on quantitative and qualitative evidence, so evidence of effectiveness and evidence of experience. So a mixed methods review follows the same steps as a single method systematic review. However, we need to consider how data or evidence is combined or integrated together, and this is dependent on factors such as the sequence in which synthesis occurs, and this can be simultaneously or consecutively, and if and how data is transformed, and how and when data and evidence are integrated together. So the JBI methodology aligns with the seminal work already undertaken in this field, namely Hong and colleagues and Sandowalski, and we focus on the convergent designs only, which we refer to as the convergent integrated and the convergent segregated approaches. So this is just a visual representation of the two approaches. So the left-hand side represents the convergent integrated approach, and the right-hand side represents the convergent segregated approach. So you can see on the left, the integrated approach involves data transformation, and that allows reviewers to combine the quantitative and the qualitative data, while the convergent segregated approach on the left-hand side involves independent synthesis of the quantum qual data, which are then integrated together. And what approach the reviewers choose depends on the nature of the questions posed. So this methodology I've outlined was based on an extensive review of the international literature, which we updated in 2019. And as a result, we obviously started to see an increase in the number of protocols and reviews that were being published that cited our methodology. When we started to look at a few of these reviews, we actually noticed that the authors seemed to be deviating from the methodology, and we wanted to know why. So we decided to explore the application of our approach in more detail. So what we did is we undertook forward citation tracking of the two seminal methodology papers published by the methodology group. This was done in June 2021 by one member of the group, who located all published mixed method systematic reviews that had cited the JBI methodology and reported that they had followed its guidance. So we excluded protocols. Then we had two members of the group independently review each of the reviews in full to examine and extract information regarding the review questions, the methods described, if the review questions and the methods reported aligned to the JBI approach, and if not, where methods deviated from our approach. So we held a meeting to compare the results of the two reviewers, and that actually demonstrated 100% agreements. So the deviations to the JBI guidance were then presented to the wider methodological group for further discussion and refinement. So I'll just hand over to Lucy now.
Thank you, Cindy. So what we found was that there were about 17 reviews that cited the JBI approach. That's between 2019 and 2021. And there was almost an equal number of reviews that followed our convergent segregated approach and the convergent integrated approach. And there was one review that did not actually indicate the approach that they used. So from about almost half of them, they actually deviated from the JBI methodology. And from those reviews that deviated from our methodology, we've identified 5 common issues or pitfalls. So the first issue that we identified related to the need for a clear justification for undertaking a mixed methods approach to the systematic review. So it should be clear from the introduction section of the review why a mixed methods approach was used, and also the qualitative and quantitative evidence basis should be described. So we know that with a mixed method systematic review, it can allow for examination of the level of agreement between quantitative results and qualitative findings. It can also identify discrepancies within the available evidence. It can determine whether the quantitative and qualitative data address different aspects of a phenomenon of interest, and whether one type of data can explain, contextualize, or explore the findings of the other type of evidence. Now, if any of these elements are not of interest to the reviewers, then maybe a mixed methods approach to the review is not the best approach. So as you can see here, we provided an example, and this was a review done by Young and colleagues, which sought to evaluate and summarize the evidence on genetic counseling and genetic testing in Asian Americans. So while it is clear from their review that they want to summarize both the quantitative and qualitative evidence, it was actually quite unclear what their intention was. And if a summary of the evidence was the only intention, then maybe its mixed methods approach is not the appropriate one. Maybe a scoping review might have been a more appropriate methodology to follow. The second issue that we identified from those reviews was the mismatch between the review questions and the type of approach that they use, so whether they use a convergent segregated or a convergent integrated approach. So as mentioned previously by Cindy, integration can occur either following the process of data transformation, where you're doing the convergent integrated, or following independent synthesis of the quant evidence and the qual evidence. And the approach you used would depend on the type of questions you're asking. So in the review by Clary et al., they used or selected a convergent segregated approach to synthesis and integration. This approach should be used when the question examines different aspects of a particular phenomenon of interest. So whether you're looking at effectiveness as well as experiences. However, in this review, they focus on the application of mindfulness-based programs in order to determine favorable and unfavorable implementation factors, indicating that that could actually been addressed by doing a convergent integrated rather than a convergent segregated approach. The third issue that we've identified is that many published reviews, or a few of the published reviews that we found, did not explicitly state in their inclusion criteria the inclusion of mixed methods studies. So whether that's a deliberate or inadvertent decision to exclude mixed methods primary studies, that could be due to the challenges that this type of study introduces to the methods of the systematic review, but also potentially missing out some important evidence. So this review by Mackenzie et al., looking at the barriers and facilitators of physical activity participation for young people with physical disability, the authors did not specify the inclusion of primary mixed methods. All they simply stated was the inclusion of original quantitative or qualitative studies. Another issue that we've identified is, and this is particularly for the convergent integrated approach, is around data transformation. So transformation occurs when one type of data is transformed into another format. So in our guidance, we specifically advocated for qualitization of quantitative data. So this review by Gonzalez and Gonzalez, although they said, and it's looking at end-of-life care preferences in older patients, stated that they followed the convergent integrated review. This review quantized the qualitative data by using meta-analysis to convert qualitative data into a numerical format for quantitative synthesis by transforming verbal counts into numbers. So what we also found was that reviews often did not report on their process of data transformation, nor provide the transformed data alongside the original data. And lastly, and perhaps one of the most important, is the process of integration is either lacking or poorly described. So in this review by Martin et al., looking at nutrition interventions with or without family engagement, The authors followed a convergent segregated approach, whereby qual and quant evidence should have been integrated following their independent syntheses. And this can be done by answering the 5 trigger questions. So in this review, the results were independently synthesized, but there was no attempt made to integrate the 2 types of evidence. So in conclusion, we've outlined a handful of common issues from the reviews that have cited the JBI methodology. The group plans to undertake a more formal evaluation of adherence to our guidance. However, in the meantime, we have a few suggestions that may be of interest. So our recommendations include ensuring that the review questions can actually be appropriately and rightly addressed by mixed method systematic review, and that they are aligned with the appropriate approach to synthesis and integration. It's also important to include primary mixed method studies in the review's inclusion criteria. And if data transformation is undertaken, the process for doing so should be sufficiently described in the manuscript. And lastly, regardless of the approach taken, the quantitative and qualitative components should be integrated appropriately. That's the end of our presentation, and I'd like to invite Cindy to join me for the question and answer. Let me just stop sharing our screen.
Thank you, Lucy and Cindy. That was a fantastic presentation and really gave us a snapshot of what's currently happening with the mixed methods reviews. Do we have any questions? If you could raise your hand or add a comment to the chat. I'll set the ball rolling. Did you actually look at, I don't think you did because you didn't say, but or do you have a feel with how mixed methods reviews are looking at this that don't refer to your guidelines?
Well, at this stage, Vanessa, we've really just focused on our guidance because we did that big review, but I think that's another project in itself because these types of reviews are really complex. Yeah. And just the lack of guidance, you know, that's available warrants a separate project, I would think.
Yeah, my assumption being that if they actually used your guidance, they will be the better versions of the mixed methods. Whereas it could be a worse picture if we look wider.
Yeah.
If we have no further questions or comments, we might move on. So thank you very much for that lovely talk. And now I'm going to pass over to Alexa McArthur. If you could unmute and share your screen. And we're going to now hear a little bit more about textual evidence. Over to you, Alexa.
Great, thanks, Vanessa. And I'll just check that you can see my screen suitably there. Thank you.
Yes, looking good.
Great. So good afternoon, everyone, and thank you for coming along to this presentation on JBI's approach to systematic reviews of textual evidence, looking at narrative, expert opinion, or policy. My name's Alexa McArthur, and I'm a Senior Research Fellow at JBI. But I would also like just to acknowledge that I am presenting on the traditional country of the Kaurna people of the Adelaide Plains, and I also pay my respect to Elders past, present and emerging. And I'd also like to acknowledge my co-authors for this presentation whose names are on this slide. They're all members of the JBI International Collaboration, and they are also members of the JBI Methodology group, so I just want to disclose that. And they are also co-authors of the textual evidence chapter, which is on the JBI Manual of Evidence Synthesis. So really today, just what I want to take us through quickly is what we as a methodology group have been working on most recently. And that's really taking our focus, especially on our critical appraisal tool for textual evidence synthesis. And I'll unpack that in a little bit more detail. So just in ways of introduction, JBI has had the methodology for systematic reviews for text and opinion over quite a few years. And as a methodology group, we've been working to further refine that. And so just to sort of put a little bit of background around this, you know, from a healthcare and a complexity of policy interventions to inform both management and clinical decision-making requires due consideration of what actually is the best available evidence. And we are the first to say that where appropriate and feasible, this should relate to evidence derived from high quality quantitative or qualitative research. However, there does remain many aspects of healthcare that either have not or cannot be fully explored by such evidence alone. And the truth is really that health clinicians and policymakers are frequently required to make their best assessment in the absence of definitive evidence. And many areas of clinical care continue to be supported by clinicians' tacit knowledge derived from their clinical experiences, or maybe the dominant healthcare discourse at the time of practice. And that's been evidenced through vaccine hesitancy of late. So in these instances, systematic reviews of textual evidence may serve, in fact, as the best available evidence. And I think the importance of this is that the synthesis of textual evidence within the systematic review process is not necessarily well recognised in mainstream evidence-based practice. And we would also acknowledge that the efforts to appraise and synthesise often conflicting opinions or narratives and policies is at best tentative. However, the use of a transparent, systematic process to identify the best available textual evidence can provide practical guidance to practitioners and policymakers. Textual evidence often represents the best available evidence where formal research on the specific topic is limited or indeed non-existent. And non-research text within healthcare is found in many places, such as published narratives from healthcare consumers or healthcare providers, expert opinion-based pieces, maybe government or institutional policies and reports, and even through social media such as Twitter or various blogs. So, you know, there's three broad indications for why you might actually undertake a review of textual evidence. And I just want to run through the three here on the slide. So firstly, it may be that it's as an adjunct to a quantitative or a qualitative systematic review where there were no research studies identified. And an example I'll just provide here was a systematic review that was focusing on the competencies required by multidisciplinary healthcare practitioners in caring for patients who are undergoing bariatric surgery. And they identified no empirical research studies that met the inclusion criteria. However, they did then find a number of narrative and expert opinion papers that were able to be used to inform these competencies that are required by this healthcare professional team. Secondly, it may be as an adjunct to a comprehensive systematic review where the textual evidence component provided supplemental evidence to the quantitative or the qualitative parts of the review. So an example of this was a review by Conno and colleagues back in 2013, and this was a focus on bathing techniques for older adults with dementia. And so they identified in this systematic review, they identified a number of quantitative studies, a number of qualitative studies, but they also, as part of this inclusion criteria from their search, they identified 8 textual opinion papers that actually added or contributed some additional information that was really relevant for healthcare providers who were providing care to this group of patients with dementia. And so this added some additional recommendations for practice in this case. And then thirdly, it may be actually as a standalone systematic review, and this might be investigating either expert opinions, or it may be around discourse at the time, or it actually might be a policy analysis. And an example of this was a systematic review that looked at local and national policy and practice initiatives in relation to reducing maternal mortality. So why do we need to sort of make a change to the current critical appraisal tool? And I just have that up on the screen at the moment. And it's increasingly being used by people undertaking non-JBI systematic reviews. And there's been a number of examples. And some of these topics have looked at issues, and I'll just provide 2 examples here, looking at One of the systematic reviews was looking at healthy, safe and effective international medical student electives. Another one was looking at enrolment issues that were affecting the retention of Aboriginal and Torres Strait Islander health students in the tertiary education system. But as a methodology group, we started to look at whether this current critical appraisal tool, as it sits at the moment in JBI's summary, does it actually work for the different forms of text that we were identifying? So we just needed to unpack this in a bit more detail. So we started to look at, was it time for a new approach? And started to look at the overarching term of text. And for our purpose, we tried to then break it into 3 types of text. So we referred specifically to documented communication artefacts other than research that inform decision-making in healthcare. And these 3 terms were narrative, referring to the recounting of real events or telling of a story, expert opinion, referring to a view or a judgment formed, and policy, which refers to policy documents that give direction for action. So as a group, some of the issues we were trying to deal with was developing a search strategy for the different types of text. We were looking at further development of different critical appraisal tools for various types of text and opinion, so narrative, opinion or policy, issues around how we would actually perform textual data extraction, and then also issues with how best to perform the synthesis, whether we should leave them separate or combine them. And we undertook a worked example to test each stage and identify further issues. So I just want to present here quickly the 3 critical appraisal tools as they currently have been developed. And the first one is looking at narrative evidence. And narrative refers to first-hand accounts of experience, perspective or views of patients, health professionals or other stakeholders. The validity of the evidence retrieved in this context relates to the authenticity of the source of the data, the relationship of the account to a particular or specific context, and the adequate representation of those involved in the event and the degree of narrativity embodied in the narrative. And there's 6 questions to that critical appraisal tool. The critical appraisal tool for expert opinion is actually very similar to what is already currently exists on JBI's summary software. And this is looking at expert opinions that draw on the knowledge and experience of experts, both healthcare practitioners or consumers, and frequently the external evidence that informs that opinion. So validity in this context relates to those involved in the development of the opinion and their motives, the degree to which extant evidence is sourced and used in the process, and the soundness of the opinion in terms of its logic and its ability to convince. And then thirdly, the critical appraisal tool for policy evidence. So policy here referring to a deliberate set of principles designed to guide decisions and achieve rational outcomes. In healthcare, a policy is essentially a statement of intent that is often then implemented as a procedure or a protocol. And so we're reviewing the authority insofar as its purpose and its focus on serving the best interests of healthcare recipients and the quality of the policy. And there's 7 questions with this critical appraisal tool on policy. And so really just in conclusion, because I'm just giving you a very kind of quick snapshot of what we've been working on as a methodology group, but translating research evidence into policy and practice remains the ultimate goal. However, efforts also need to be cognizant of context and the pressures and urgency associated with the development of meaningful policies to inform decision-making, which can often be quite a grey area. As such, the reviews that consider textual evidence may offer a credible approach to dealing with uncertainty in a real and systematic way. And although it is a synthesis of non-research evidence, there are still many fields where the research evidence is missing and where textual evidence is the best available evidence. Systematic reviews of text may be considered as a legitimate source of evidence, especially when there is an absence of other research designs. Through incorporating textual evidence, it may well be that clinicians and policymakers will receive highly content-specific insights to improve their everyday clinical practice. And just in terms of some future directions, please note that these 3 distinct critical appraisal tools that I've just discussed here are still being in the approval process by the JBI Scientific Committee as yet. So we're still pending approval, but hopefully that will happen in the next month or so, and then they will be written up into the chapter in the JBI Manual of Evidence Synthesis, and that will be updated as well. And hopefully then there will be changes, and then these will be incorporated into the JBI summary software. And just some textual evidence reviews as they sit in the JBI Evidence Synthesis Journal are just listed here. And here are just some other resources if people are interested in having a look at those. Thank you.
Thank you very much, Alexa. I think it's a great time for you to be producing these tools where we have an influx of narrative and opinion that is coming our way with the health crisis that we're currently experiencing. We've just got something from Miranda in the chat. Can you comment a bit further on how these tools are applied in practice for reviews of textual evidence and integrated into the review findings and discussion?
Yeah, look, thanks, Miranda. Because of the time, obviously, I just sort of wanted to focus in on the critical appraisal tools. But after the critical appraisal process within JBI summary, conclusions from each of the papers is extracted, and then they're assigned a level of credibility, and then they're synthesised using the meta-aggregative or JBI's meta-aggregative approach. So it's all sort of conducted within JBI summary, and it's still a work in progress, but then trying to also establish some certainty or confidence in the findings, which is obviously a fairly, it's an interesting area, but obviously we're looking also at what Grade's been doing in this area as well and wanting to follow their guidance. So that's still an ongoing issue.
And another question from Barbara, just asking you if conflicts of interest are considered at any point within the policy.
Yes, yeah, thanks, Barbara. As it stands at the moment, and we were just talking about this the other day, it's not actually an individual question, but I think it is something that obviously is important. And I guess what we try to have a look at is you know, the standing of that expert opinion, or whether it's the expert or whether it's the consumer expert. So considering their standing or their position in the field. So, I mean, that's something that I think we need to address probably and take away. But thank you, that's an interesting question.
So thank you again, Alexa. That was a great talk. And we'll move on to our last talk for the session, which is from Ashley Whitehorn. And Ashley is going to do a quick oral for us, looking at scoping reviews.
All right, so I pre-recorded my presentation, but I just quickly also like to acknowledge the Kaurna people and pay respects to elders past, present and emerging. And I'm a research fellow at JBI with no other conflicts of interest to declare. So let's hope this works. Good afternoon. My name is Ashley and I will be presenting today on behalf of my colleagues on the scoping review that we conducted on reporting standards and quality assessment available for evidence summaries. Clinicians require the most up-to-date, highest level evidence in order to provide their patients with the best possible care. However, it is easy for clinicians to become overwhelmed by the vast body of literature that continues to grow each year. I think COVID-19 has really shown us just how quickly evidence can be produced, and that clearly not all of it is of high quality. And even systematic reviews that are synopses of the evidence on a particular topic may be challenging for clinicians to navigate and apply in their own clinical setting. The point of for clinicians to quickly access the information that they need, but how can clinicians be sure that the information is both accurate and trustworthy? Ideally, the methodology behind evidence summaries that are intended for clinical use should be transparent. A summary should be created by people with appropriate literature searching and critical appraisal skills and experience with the input of key stakeholders. And therefore, the objective of this scoping review was to identify and map the available evidence related to evidence summary methodologies, and more specifically, how evidence summaries are defined and structured, the core methodological components of the evidence summary, and the available tools or instruments to assess the quality of the evidence summary. In order to be included in this scoping review, we used an adapted version of the definition of an evidence summary from Munn and colleagues, and therefore in this scoping review, an evidence summary was defined as a brief synopsis of literature on healthcare interventions or activities, which can be used to inform decision making at the point of care. So we had a fairly broad inclusion criteria. We included any healthcare resources for clinicians that met the previously mentioned criteria of an evidence summary. We included all settings, professions, and modes of delivery. We excluded systematic reviews unless it was a review of the evidence summary methodology or appraisal tool. Rapid reviews, integrated reviews, health technology assessment, clinical practice guidelines, or knowledge translation resources were also excluded, and we excluded anything that was not published in the English language. There's a number of databases, including PubMed and CINAHL, and carried out a fairly comprehensive grey literature search, including the Grey Matters Handbook. We're looking for any article, paper, book, report, website, or thesis that met the definition of an evidence summary, described methods for an evidence summary, or described a tool to assess the quality. We predominantly present the data as frequency, so for example, structure, with a background or context section included, with data presented as tables or in paragraphs. Core methodological components, how often did a systematic search or critical appraisal of the included evidence here. And finally, how many quality assessment tools were available. And then we use content analysis when it came to the definition of an evidence summary. The two reviewers independently screened 31,572 records, and of those 242 full-text records were also independently reviewed by the two. A total of 47 records, including 5 different types, were included. So these included products, which was the final evidence summary that is used by clinicians. Products plus methods were where both a methodological paper and an example product were available. Methods were usually published journal articles on the methodology of a particular evidence summary, such as the JBI method. Instruments were the critical appraisal tools, and overviews were usually systematic reviews that provided a summary of multiple evidence summary types. Although it was predominantly products or methods plus products that were in the end included in the review. What did we find? Well, of the 47 included papers, we found 24 different expressions of the term evidence summary. The most commonly used terms were evidence summary, best evidence topics, and critically appraised topics. And although each evidence summary had a unique definition, there were some common themes that were identified in content analysis. And this included succinctness, timely use of best available evidence, systematic approach to the search, praise, synthesizing evidence, and clinical application or relevancy. So this slide shows key methodological components of the 17 articles that had both methodology and product. So from these you can see that the majority did have a systematic search. Around half did include a clinical question and reported quality appraisal of the included evidence. while less than half provided clinical recommendations, but of the 7 that did provide recommendations, 6 of them reported using some kind of rating system. So we located 3 critical appraisal tools. So the critical appraisal for summaries of evidence or case, evidence summary tool, and evidence-based medicine point of care tool, evaluation rubric. And of those 3, only the case have been validated. The results of this scoping review highlight a lack of consistency in the definition of reporting standards for evidence-based point of care resources, which can ultimately erode clinician trust in these resources. So what's next? We have updated the search and are currently extracting the data. And following on from the scoping review, we are looking forward to creating a standardised definition of an evidence summary and also developing international reporting standards for evidence summaries. Thank you, and I am happy to take any questions.
Thank you very much, Ashley. That was a great look at evidence summaries and a good scoping review for us to all have a look at, and I commend you going through 31,000 papers. That must have taken a fair bit of time. Do we have any questions or chat for Ashley? We did have one question from Karen. Did you find that the evidence summaries specified the audience that they were aiming towards?
So we looked at, because we were obviously looking for point of care resources, so we looked at whether they were they were specified for policy or for clinicians, because it had to have one of those elements to actually be included in the scoping review. So overwhelmingly, it was targeted at clinicians.
Okay, if we have, we've got something from Aidan. Do you know what existing critical appraisal processes are used in the existing point of care tools, i.e. up-to-date, BMJ, best practice, etc.?
So that was part of, so I only presented a small part of this scoping review because it was quite a large scoping review. So we have that data, we just don't exactly know what it says. I suspect overwhelmingly they're not critically appraised.
If we have no further questions or comments, then it's just up to me to wrap up this session. I'd like to thank all the speakers. It was a fantastic group of presentations, and it's really great to see that we're getting so much good guidance coming out on the different types of research. I know when somebody comes to me to help them with a scoping review or a systematic review, the first question I have to ask is, what do you think that means? Because there seems to be a lot of definitions that are in work as we go. But feel free to put some more questions in the chat, or you now have a half an hour break until the next group of sessions, which are some lightning talks. So lovely to see all you on the chat, and hopefully we'll see each other in sessions going forward over the next 3 days. Thank you again to all the speakers.